So good afternoon everyone. At the outset I am thankful to the organizers of AIOS. I am Dr. Rohit and I am here to discuss about the risk factors associated with high endothelial cell density decrease after Descemet's membrane endothelial keratoplasty, that is DMEK. Coming to the DMEK as such, we know endothelial keratoplasty, it represents a paradigm shift in a corneal transplant surgery similar to what phacoemulsification has done to a cataract surgery. What I mean by that is providing a closed eye, a sutureless surgery with an early and a very predictable visual recovery. Coming to the present study, the purpose of the study was to evaluate which parameters may affect the endothelial cell density decrease or loss of endothelial cells after a DMEK by comparing eyes in the low versus high quartile of endothelial cell density decrease over a follow-up period of 4 years. So we are taking up a combined approach where we combine a phacoemulsification or cataract surgery with a endothelial keratoplasty in a form of a DMEK, and as the various studies suggest, whenever we are seeing a pachymetry more than 630 microns, it could be a indication for a phaco triple. What I mean is a phaco with a DMEK as such. So the progressive endothelial cell loss in a keratoplasty, the traditional penetrating keratoplasty, we had seen that the 5 to 10 years after PK, the endothelial cell loss is around 4.2% per year, and which is around 7 times the physiological loss of 0.6% which has been documented. Now the endothelial cell loss in EK patients plateaus more quickly than those in patients who undergo penetrating keratoplasty, and the various studies have shown that, and we are here to compare how the endothelial cell loss is seen in two different groups. So how did this study go about? It's a retrospective study, and 151 eyes of 101 patients who underwent a DMEK for Fuchs endothelial dystrophy and who had a donor endothelial cell density decrease as compared to the pre-operative endothelial cell counts was evaluated over a period of 4 years. And eyes with a post-operative endothelial cell density decrease in the lower quartile group at all available follow-up moments were assigned to group 1 and those in the upper quartile to group 2. And a multimonial regression was used to assess which covariates were related to the different patterns of ECD loss or ECD decrease. Coming to the results, the mean endothelial cell density decrease for the entire group was around 33%, 36% and 52% at 1, 6 and 48 months post-op. While at those time points, the endothelial cell density decrease in a group 1, which was a lower quartile of endothelial cell density loss, was only around 12%, 13% and 26% at the same time frame, and in the second group, which had a higher loss of endothelial cell loss, it stood around 59%, 64% and 75% at same period, that is at 1 month, 6 months and 48 months post-op. The partial graft detachment, the post-operative complications other than the graft detachment and the severity of pre-operative Fuchs endothelial cell density showed the strongest relation with the different patterns of endothelial cell density post-operatively. This is a graphical depiction of a mean endothelial cell loss, which shows at 3 months it was 32%, at 6 months 36% and 48 months it was around 52% for an entire study group. While if you can see the upper in the group which had a lower endothelial cell loss, it is like 12%, 13%, 26% as compared to 59, 64 and 72% at the same time frame in a group 2. Now on an AIOS2025, the presence of a H2H graft separation, it could be one of the most important risk factors for a more or significant endothelial cell loss. The phaco DSEC, what you can see is the procedure could be simple.
We are going to discuss or see here
if as long as it goes well, it's a phaco triple procedure.
Endothelial dystrophy and advanced cataract. As you can see in this patient, once we remove the epithelium, the cornea,
run through the routine phaco.
Phaco is performed in a routine
lens implantation
and trying to keep our axis small, so that then we make
and then your Descemet stripping like in your routine DSEC. And very important part of a dissection of an endothelium
as a 10 mm so as to hook the Descemet donor graft.
And then
once that is done, the donor graft is then
insertion of the graft and proper unfolding inside the anterior chamber. So to conclude, the DMEK eyes with a completely attached grafts and operated in an early stage of Fuchs endothelial cell density may show the lowest endothelial cell density decrease post-operatively. That's what I conclude with this study.
Hi, good. So was that the video you showed, was that DMAC or DISEC?
It was DMAC, sir.
No, so DMAC, sorry, the OCT image. We just go back.
The OCT image, it was just to document the graft separation. It was obviously a DISEC graft, which was a very thick graft as such.
Yeah, but you're talking of DMAC, no, in this paper.
Yes, it was just to document the graft separation that I had picked up.
So this study was DMAC, not
Yes,
DISEC,
sir.
or was it a mixed
No, it was a DMAC study.
DMAC study? Okay. Any questions? Audience?
So the allocation to group 1 or group 2 was based on what?
It was at post-operatively, what was the cell loss that we are seeing, endothelial cell loss on specular counts.
Okay, and then you retrospectively analyzed the reasons for the extra cell loss?
Yes, if we correlate, like the endothelial cell loss was very severe, and go back and study the how was his post-operative course, we always correlated or like had some correlation with some sort of secondary intervention like rebubbling or some sort of the graft was not very well centered or something, and that related to more significant endothelial cell loss.
So all the patients who showed an initial cell loss which was high persisted in the third and the fourth year?
Yes, it went in the same graphical depiction, like in a group 1 it was, once it was he didn't had any untoward incidence or something, or it went all uneventful. He had a less cell loss, as you can see, 12%, 13% and 26% at various time frames. In a second group, once it was a significant cell loss, the same thing continued in a further time frame also.
Okay. Okay, great. Thank you very much.